Doctors of Reddit, what made you say how the duck is this person still alive? An unlucky guy forgot his keys and was climbing back into his own apartment through the window. His cousin friend thought that he was an intruder and pointed a gun at him and pulled the trigger as the unlucky guy opened his mouth to say don't shoot. The bullet went into his mouth and clean exited the back of his neck. After surgery, he was totally fine in a few days. Somehow missed all major structures. Didn't even chip a tooth. Really pissed at his cousin. From my neurosurgery rotation in med school. Edit. THX for my first silver and gold. My second most upvoted comment has 33 votes. So 37k is pretty surprising. Unlike the bullet, this comment hit a nerve. Edit 2. I didn't delve into why, but for some reason the patient didn't know that his friend cousin was in the patient's apartment, and the patient assumed that he was locked out. Edit 3. I think I have a poor sense of what is interesting in medicine to the general public. This was interesting enough for me to remember from med school. Definitely made it to med students can't help talking about medicine even at parties. But it never struck me as that interesting. Edit 4. This has forced me to learn how to do a hard return. Edit 5. Maybe too many edits is rude. Relatively untutored in the ways of Reddit. When I was in college, there was a kid that exited a freeway at near freeway speed. Problem was, it was a construction zone at night, no lights, and it wasn't supposed to be an open exit. Drove right into a pile of rebar. One of the poles went through the car into his face and pinned him to the seat through his head. A couple of years later, I was in grad school, in anatomy seminar, and the surgeon presented that kid's case as a study. Not only did he live, the rebar had slid right past the base of the brain spinal column. It was so close, they had to twist it out like a screw because the ribbing on the bar threatened nerve damage. They literally rebuilt this kid's skull around his brain. His recovery photo was a totally normal kid smiling. He had a small scar on his chin. I say kid, but he was like 17. Just to be clear. Edit. A couple of people looked up the story and posted it in the responses. For the curious, be warned, there is one photo you may find disturbing. I had some minor details wrong, but I hope I'm forgiven since it was 15 years ago. Edit 2. Everyone keeps bringing up Phineas Gage, but this guy didn't have any brain damage at all. This guy, one of my prior patients, is a roofer who lived a very full life of alcohol, women, and drugs. He was infected with HIV, hepatitis B, hepatitis C, and was cirrhotic and didn't really care about his health at all. He was ghostly thin and weighed 110 pounds on a 6-foot frame, which included 20 pounds of ascites in his abdomen. He was angry and didn't listen to anyone, refusing therapy most of the time. I met him first in the ICU, where he had full-blown AIDS, end-stage liver disease, hepatorenal syndrome, unexplained lymph nodes all over his body, variceal hemorrhage, Kaposi's sarcoma, and spontaneous bacterial peritonitis. Prognosis of in-hospital death was more than 90% even with therapy. I was involved in his care for about 2 weeks and again he refused every therapy that his primary physicians suggested. I was surprised he lasted the 2 weeks. Finally, he was so fed up with the noisiness in the ICU that he requested transfer to palliative care, and was eventually sent to a hospice for patients with advanced HIV to live out his remaining few days. 1 year later I get a call from the hospice requesting a follow-up appointment for him. I was shocked that he was still alive and asked if I could talk to him. He was all better. Turns out he had the hots for his nurse in the hospice and did everything she asked in order to please her, including taking his medications for the first time. She had slowly nursed him back to health, convinced him to restart HIV meds, put him on a low salt diet for his liver disease, and then eventually got him up and mobile. He spent another 6 months in a rehabilitation facility, then went back to work. He saw me in follow-up for a while as we treated his hepatitis C. Then his cirrhosis shockingly improved. After a couple of years he moved away to another place to start a construction company and became rather successful financially, and remains abstinent on his former vices. He's the only person that I've seen come back from death. My resident called me urgently one night and said I needed to come to the hospital. A young man was cut in half by a train. I asked why I needed to come in. There was no way he could survive that. She explained that somehow he was maintaining his pressure and wasn't bleeding out. When I arrived, I found that the force of train had sealed off all the major vessels from the pelvis down. 2 that stick out. Guy gets shot in the abdomen. Drops to his knees. Shooter puts one through the top of his head near his forehead. Bullet exits through his jaw. He wouldn't stop complaining about how much he hates that the guy who shot him. Young girl driving a car gets T-boned on the passenger side by an Altima going at least 70 miles per hour. Her car looks like it was hit by an IED, so we assumed she was deceased upon arrival when the other crew on scene said our focus was extricating the people in the Altima. Girl driving was completely unhurt by a Volvo. A guy I know with cancer smokes 2 packs a day and drinks a fifth of Fireball every day. He lives in a trailer so dirty there is a ½ inch of dirt according to his wife's mother. He recovered from surgeries in that trailer. Eventually we got word he was quitting chemo and was just going to accept death. 5 years ago he was given 2 months to live. He is now completely cancer free. Life is just weird sometimes. Kind of a retelling, but one time a cadaver on which I was performing an autopsy had a lung which was flipped upside down. When I tried to flip it to the proper position, bloop, it flipped right back to upside down. After some due diligence we realized the lung was a transplant, and the surgeons who performed the transplant had attached the organ incorrectly. The lung had been fighting to be upside down its whole life in this other man. After 15 or so years, the man eventually moved in a way that allowed it to flip over, resulting in his death. Not really a how the duck is this person still alive, but more of a how the duck did this person live this long with this condition. As a student, had a young guy come in who self-inflicted a .22 to the inside of his mouth and passed out. Awoke the next morning. Didn't recall the night prior. Went to work. 2 hours into work he says he's not feeling right and starts acting odd. Co-workers call EMS. They take him in and while the ED is working him up they notice a mix of clear fluid and blood in the back of his mouth. They call ENT and get a CT head. Shows 11 or so bullet fragments throughout his noggin. The guy was acting by that time completely unfazed. I was very fazed. Edit. Engage phases. Not a doctor. A classmate of mine in HS was out snowmobiling in the middle of the night. He was going about 50 miles per hour down a trail. Some asshole had put a chain across the trail just to be an asshole. He didn't put reflectors on it and it wasn't even on his own land. It was on state land. Unfortunately, a classmate had a backrest on his sled. The chain hit him square across his chest. It slammed him into the backrest which fortunately broke off. He rode back home and crawled into bed. Later, his mom made him go to the local clinic that had a small ER. They life-flighted him down to Duluth immediately. He had a ruptured spleen. Part of his liver was torn. His heart was badly bruised. And he had a collapsed lung. He was bleeding pretty bad internally. The doc told him that, if he hadn't been so muscular, he would have died out on the trail. The man was about 6 feet and 245 pounds and ripped like a bodybuilder when he started. 6 months and a bunch of surgeries later, he was maybe 130 pounds. He looked like death and his whole chest was railroad tracks. They had to crack his chest twice to deal with his heart and open up his abdomen numerous times to deal with infections. Now, he's the same loud crazy person he always was. A successful business owner with a wife and kids. Everyone thought he was going to die, including the doctors, but he pulled through. Any of the patients with flesh-eating bacteria and massive debridements, those are always a good source of what the duckery. Had a lady walk into the hospital with her face pointed at her chest. Her C1 vertebra had somehow fallen off C2, with her spinal cord delicately draped across the odontoid process. No damage to anything. Repaired with slow traction and a halo for a little while. Still baffles my mind 5 years later. Edit. Lots of questions. This little old lady said it happened slowly over time. But when she woke up from her nap that evening, something felt different. No traumatic injury reported. She had been sidestepping for almost a year. I haven't had time to draw a diagram yet, but I'll come back in a little while when I have a chance to doodle one. Edit 2. Behold, my attempt at a diagram of how she looked. I'm afraid it doesn't make the situation any less scary. I helped take care of an old dude who had one leg amputated and had broken his other leg, so he was seeing us because of that. He was on oxygen and not being very compliant with using his wheelchair. We were talking with him and he was getting really argumentative. How am I supposed to chop wood in a wheelchair? Was what he kept demanding. When asked how he was chopping wood with one leg in the first place, he responded that he'd crawl into the woods and hop up to chop the wood. This was even more concerning when the doctor asked how he was carrying his axe, oxygen, and the wood he chopped. He looked him straight in the eye and said, "I carry Sim on my back." Not sure if he was serious, but he was pretty dang grizzled and looked like he may have been crawling through the woods. Older woman called 911 for chest pain. Her vital signs were it, and she had the look that anyone who's ever seen a patient about to die will recognize instantly. Her EKG suggested multiple blockages in her coronary arteries, and we had to put her on a ventilator shortly after she got to the ER because she deteriorated so quickly. Cath lab confirmed the EKG findings: complete blockage of one artery and 99% blockage of two other major arteries. Unfortunately, it was too extensive to resolve with PCI, so the only option was to fly her to the university hospital in the city for an emergent triple bypass. It turned out that she'd had multiple episodes like this, but not quite as severe, over the last 6 months, and had refused bypass surgery not once, not twice, but 3 times in favor of a Mediterranean diet. Well, at this point she didn't have much say anymore and family agreed, so off to the OR she went. I took care of her again about 4 months later and she actually seemed to have made a remarkable recovery. Working in an Aboriginal community, a woman walked in complaining of a headache behind her eye. She was told to take a seat, and as she turned around she had a butter knife sticking out the back of her skull. Apparently a drunk relative came home and stabbed her while she slept. Edit. Yes, she survived. Was flown back to Townsville for imaging, then on to Brisbane for surgery. I'm still fairly new in my training, but one of the first crazy recoveries I've seen. College kid was out drinking with his buddies and had a bit too much to drink. He presumably aspirates some of his vomit and it causes this massive inflammatory reaction in his lungs called ARDS. He goes from perfectly healthy to being on death's door within an hour. He gets transferred to our ICU in the middle of the night, completely unstable, on a ventilator, maxed out on 5 pressors, life support meds to keep your blood pressure up, and is being considered for ECMO. Edit. Basically like a temporary machine bypass of your heart and lungs, used as a last ditch effort to save someone. His parents are on a last minute flight from out of state with no bags packed to get to their son. Our team is concerned that he won't make it through the night, and braces friends for the worst. The treatment for ARDS is actually something called proning, which is when you literally just flip the patient onto their stomach, and miraculously, 2 hours later he is off all pressors, maintaining his own blood pressure, and so while very sedated from all the meds is able to respond to voice and shake and nod his head to questions. He makes a full recovery 4 days later, and vowing to stay away from alcohol for a while. Edit. To translate the medicalese a bit, ARDS equals acute respiratory distress syndrome. ECMO equals extracorporeal membrane oxygenation. ICU equals intensive care unit. My dad walked a mile to see a friend and tried to walk up the stairs. Couldn't get up 1 step. Walked back 1 mile to his office. Looked up who his doctor was, since he hadn't seen one in 20 years. And drove there. No appointment. DR. Hooks him up to an EKG. But it's fine. Tells him there's a cardiologist next door. It's the end of the day. They'll see him. Just in case. They hook him up to a blood pressure monitor while he's on a treadmill. The monitor is behind him. He can't see it. He starts walking. They set a countdown timer for 3 minutes. And about 30 seconds in, one of the nurses steps out of the room. My dad is watching the timer and it counts down to 0. He feels fine and figures he's going home, but the door opens and 2 ambulance attendants are wheeling in a gurney. While he was on the treadmill, his blood pressure dropped to 0. Then restarted. Then dropped to 0 again. The nurse who stepped out of the room dialed 911. They let him finish because they figured as soon as he stopped, the heart attack would start in earnest. Quadruple bypass later and he lived. But note, he said he never felt the same. Bypass is not a panacea. Edit. Panacea less than panacea more than solution to all problems. Apparently, not a commonly used word. For me it was a guy who was cleaning his loaded shotgun and it blew half his face off, jaw and all. He was actually pretty good from the mid-nose up. The thing that surprised me is how good of shape he was in afterwards. He didn't even go to the ICU, we just admitted him to the med-surg floor. He was up communicating via whiteboard within a few hours and was adamant that he did not try to kill himself. Got a psych consult anyway, but they agreed. Another inch dorsal with the barrel of that gun and he would have been done for. Work in a hospital. A guy showed up who had burst a tire going 180 km/h and flipped his car multiple times. His car was a write-off. The only injuries he got were a few scratches and a bruise. Edit. Thanks for internet points. No, I don't know what car he was driving. I'm not a doctor, but I was diagnosed with Addison's at age 13 or so. Was just generally feeling lethargic, vomiting, dizzy. Mum calls the hospital with symptoms and they said if I had all three at the same time to come in to be safe. Orderly or whatever checks my pulse in the lobby. 30/15. He laughs, well this one's broken, and gets another machine. 30/15 wait. What? Calls a doctor. They double check it and run me to the ER for fluids. Again. Not a doctor here. But apparently that's not even high enough to have a pulse. They had no clue how I was walking, let alone conscious. But saw the numbers and after realizing it was accurate they freaked the hell out. And of course that freaked my mom out. Them telling my mom 30/15 is the BP of a dead person did not help. And then they said it's either autoimmune or cancer. My immune system apparently ate my adrenal glands. Now I'm on meds for life. Lucky me. On the bright side though, I never really have to worry about high blood pressure. You know those big 16-18 inch kitchen knives that everyone has? Had a lady come in with one sticking sideways out of her neck, handle on the left side and top sticking out the right. She went to law, where they removed the knife in one of the most tense, arsehole clenched moments in history. Minimal bleeding. Apparently the knife split right between her major blood vessels and airway. Was lying right against them. Didn't scratch him. Absolutely incredible. Infantry guy in Afghanistan in 2009. Some old guy came up to us in a bazaar and asked us to give him a ride to a city. His arm was wrapped up. We said no, since we don't exactly do that. He unwrapped his arm. His hand wrist was missing and his two arm bones were exposed and white. Everything else was green and black. I have no idea how he was alive, much less up and walking around. Veterinarian here. An approximately 6-week-old puppy was presented that had been crushed by a car and thrown away in a dumpster, left for dead. A good Samaritan found her and brought her into a clinic for euthanasia. It was a Saturday afternoon. He was about to close up shop for the weekend. And now this. She was a little fuzzy black ball, about 1.5 pounds, with soulful eyes, abdomen gashed open, left leg midshaft femur fracture, right side hip shattered and pelvic fractures. Had been this way long enough that her quadriceps had contracted and the leg was hyperextended, bent backwards at the knee. He took the puppy in, looked at his nurses and said, I'm not starting my goddamn weekend like this. I'll stitch up her belly and figure out what the duck to do with her Monday. Monday rolls around and he brings her to the main clinic so that the vet student can practice fracture fixation before pup is euthanized. Vet student, me, says in tearful voice, if I fix her properly do I still have to put her to sleep? Answer was no, but if you do that you have to find her a home. Her name is Bits. Another vet student got the other hit by car stray dog to practice on. The nurses named her Pieces +1 for dark humor by nurses. So I anesthetize her, prep the left leg planning for an IM pin, start making the initial skin incision, and she doesn't bleed. Pretty sure that was a bad sign. So I chose to wake her up from anesthesia, give a blood transfusion and try again the next day. In the interim I do diagnostics and this little munchkin has, in addition to both back legs crushed and belly wound, hookworms, roundworms, whipworms, coccidia, demodectic and sarcoptic menages. I look at her and asked her, how the duck are you still here? Seriously? She just looked at me and did little puppy grunts. Next day her crit was holding steady, so I moved forward with surgery plan. Single IM pin in the femur, and I had to manually flex the knee to RIP through the scar tissue and return it to normal position. She recovers well, held her in my arms, I put her in the cage and set off down the hall to see some walk-in rooms in the meantime. 2 hours later and I check up on her. Vitals great. In good spirits. But that damn leg is sitting backwards at the knee again. In puzzlement, I ask my mentor what I should do. He tells me to flex the knee manually again. I asked if that was safe. To sedate her again so soon. He told me to do it without sedation. Cue horrified, shocked look on my face. He sees my reaction. Then tells me matter-of-factly that you're gonna have to do that every 2 hours for the next 2 days or that scar tissue will just come back. I go back to the pup, love on her and apologize ahead of time for the pain I'm about to inflict. Even with meds on board I knew this was gonna hurt like a sonic. She screamed in the most heartbreaking way. I was expecting her to bite me but instead, she just licked my hand afterwards. I looked at her and said, "You have got to home, little lady. Oh, coming with me tonight." 2 days later and I've got the scar tissue thing under control but flummoxed about how to keep the leg from flipping backwards. Both back legs broken. Down to one working hip and one working knee on different sides. My mentor and I put our heads together and rigged up a contraption involving small iron pins placed transversely in proximal femur and distal tibia, bent into hooks on the end. Connected by steel suture to limit extension and orthodontic rubber bands to encourage dynamic flexion. We didn't have an Elizabethan collar small enough for her, so I took x-ray film and cut one out and duct taped it together. She couldn't use either back leg. She was dragging herself along using front legs when I took her outside. Cutest little Franken puppy. Spunky as hell. Little yippy barks looking at the squirrels in my yard. A week later and pelvic fracture, sequelae, rear ugly head. Her abdomen is bloated. I'm in my yard at midnight giving her mineral oil enemas and promising God if he will help her poop I will build her a doggy wheelchair. I don't care if she never walks again. 3 weeks later and furball tore up her e-collar. Pulled the pins out of her bone with her teeth. And 2 days later is somehow running in same yard attempting to catch squirrels. 3 months later she is catching them. And anything else she can find. She was my bestest friend for 8 years. She went on to survive 3 water moccasin bites, an attack by a boxer, and liver and kidney failure, probably damage from the snakes. Duck water moccasins. I euthanized her at 8 years old, after her last stay in the hospital for kidneys. She came out and her old skeletal injuries were causing her pain. The day she laid on the porch and watched a squirrel in front of her without trying to chase him. She looked at me with such sadness I knew this was that quality of life moment. I took her to Popeyes and got chicken. Let her eat until she was blowed up like a tick. Then to the clinic. I held her in my arms and said goodbye, my badass snake killing, squirrel chasing miracle of a best friend. I love you forever. Damn it, I'm sobbing now, I miss her so much, guys. Not a doctor, but firefighter. We had a 30-year-old male put a shotgun in his mouth pointing up to his nose, pull the trigger and survive. We show up, work him. He's breathing, but missing most of his face, and we transport him. He survives and we are all amazed. 3 months later he does it again. But a .22 to the temple, it bounced around and exited through his eye. He survives again. With some mental deficits and a glass eye. But still one of the craziest I've seen. 15 years ago my mum dated a guy who had both a brain tumor and leukemia. To treat the leukemia they had to stop treating the brain tumor and vice versa. He was given 2 years to live. He told my mum that he needed to focus on getting his affairs in order and spend time with his kids. They'd only been dating a few months. Very casually. Saw the dude a few weeks ago. Still kicking. Still has the tumor. They successfully treated the leukemia. But now he has osteoporosis and a sort of not epilepsy. They found out he had brittle bone when he had a seizure and broke a lot of bones falling down. But he's just getting on with it. Couldn't kill the guy with an axe. Obligatory, not mine. But dad was an ER doc and one he told a lot one I was present for were. So a guy with a blood alcohol level of 0.85 was basically dead on a gurney, not breathing. Suddenly, this ducker sits up and punches my dad right in the face, says turn those damn lights off, and then lays back down and passes out. Apparently, he was a massive alcoholic and no one knew how he was still alive, and he had some kind of crazy tolerance built up. Sucker accident ahead of us on the freeway one day. Dad goes running up, so I see none of the gore, but driver is suspended in his seat in a flipped over car. The car and the guy were both ripped in half at about midsection. Dad goes to work on this guy who is fully conscious and rather concerned he is missing everything below his hips. Being upside down kept enough blood in the guy's brain that he was awake for a while. Long enough they landed a helo on the highway and tried to fly him to the hospital. He didn't make it. And I have never seen so much blood in my life. Dad left his clothes on the side of the road after giving the highway patrol a statement, dropped me at school in his underwear. None of this struck him as strange at all. Best one I saw was a guy shot in the back, half an inch from his spine. He was totally stable sitting and talking to us. We saw the bullet sitting in between his SVC, aorta and esophagus with injuries to no vital structure. Walked out a day or two later with just a band-aid. Literal millimeter either way and he would have been a corpse. Paralyzed or needed major reconstructive surgery. To be clear, we saw the bullet on CT scan. Not a doctor but a student nurse. I had a patient come into the psych ward from the emergency department after he had cut off his own right arm from the elbow down with a ducking chainsaw. He only survived because he apparently had some kind of rare clotting disorder that prevented him from bleeding to death. He was severely schizophrenic and believed that his arm was going to grow back. I didn't expect this to blow up the way it did. I love this story because my dad was a psychiatrist. And I finally have something way weirder than any of the tales of his profession he ever told. Happy you all found it as interesting as I did. Med student here. My most memorable patient was a particularly pleasant middle-aged man who was flown back to my hospital in the Midwest after suffering a 6-story fall from a hotel balcony in the Caribbean. The story goes this poor fella just arrived at his hotel planning to spend a week in paradise. Immediately upon arriving to his hotel, he stepped out on his balcony to watch the sunset and leaned on the railing only to have it collapse underneath him. He fell 6 stories straight down and suffered bilateral open tibial pylon fractures, which are particularly high energy and difficult to heal. The poor guy apparently fell into a locked backyard and his wife and kids had to listen to him screaming in pain and bleeding for over 2 hours before they could get the fire department to break down the gate. He was taken to the hospital on the island he was staying where he was stabilized and they recommended he have both legs amputated. He begged to be shipped back to the United States. And apparently, the government got involved and flew him to Miami where he was externally fixated and transfused several times. I guess he had some internal trauma as well. About a week later, he was shipped up to the Midwest to my hospital. Literally blew my mind the this poor guy went through just because he wanted to enjoy a vacation. Sadly, I think that he ended up losing one of his legs anyways because his wounds wouldn't heal and he ended up with osteomyelitis, bone infection. Another weird world of genetics post. Got a sample involving some kind of offbeat case where they wanted prenatal paternity testing plus analysis from my company without telling us anything about the patient in the background, as sort of a blind verification thing. The paternal test results strongly suggested that the prenatal sample appeared exclusively paternal. The fetus only had one set of autochromosomes. Humans have, usually, 2 sets. At this point we decided to stop referring to the prenatal thing as a fetus because genetically, this is generally incompatible with life. The answer, it was DNA from the products of molar pregnancy, which I highly encourage no one to read more about, as it's pretty ducking creepy. A few years back my wife was doing clinicals at the local hospital while still in school and a guy came in with a blood sugar of 9, and he was totally conscious lucid. As a type 1 diabetic myself I almost fell off my chair when I heard that. Not a doctor, but March 2018 my father, who is a type 2 diabetic, ended up in the ER because of high blood sugar. Don't remember the exact number, but his blood sugar was over 1000. Handfuls of doctors and nurses told me that was easily the highest blood sugar reading they'd ever witnessed. They couldn't believe he was alive or at least not in a diabetic coma. His blood was the consistency of syrup.